So here you are seeing drug-induced sleep endoscopy of a 49-year-old male with body mass index of 30.5 and apnea-hypopnea index of 30.7, mostly obstructive apneas. So on the CT scan of the nose, he has got a slight deviated septum on the right side. We are doing the drug-induced sleep endoscopy with this monitoring. So when you see from the left side, you can see a little bit of turbinate hypertrophy on the left. On the right hand side, you can see the deviated septum and turbinate hypertrophy both. So that's this part. And as you go inside, nasopharynx looks normal. The salpingopharyngeal folds are grade 1, between 25% to 75% by Agrawal's classification. Not completely obstructing, and the obstruction is mostly at the soft palate level. As you can see here, it's a funnel kind of collapse. Lower part of the soft palate is collapsing, and you can see the patient in apnea. This is how snoring and apnea happens. So he's in the correct base level between 60 to 80, and you can see that he's unable to breathe, and it's mostly at the soft palate level. At this point, if we see down, the base tongue is not really completely collapsing. The epiglottis is normal, the airway at the lower part is normal. His main collapse is at the soft palate level. Again you see a cycle of snoring and apnea happening completely at the soft palate level. That's the tonsil, almost touching the tongue, lower part of the tonsil. And the upper part of the tonsil, as we have demonstrated earlier, causes the sleep apnea. So this is the cycle of apnea and snoring. So it does not require any procedure for base tongue and epiglottis. He only requires procedure for the soft palate, which will be modified uvulopalatopharyngoplasty with suspension bridge palatoplasty by Dr. Vikas Agrawal. Thank you for watching.